Hi, Lisa. You're going to get grilled. You know, the really great thing about doing it like this, you know, the third and fourth and the fifth patient, they know exactly where I'm going to go, and they might even have altered their answers. I know I'm going to say when he says that, I got a good one for this guy. But just to let you know that these are all people that all get their teeth cleaned. They all have a dentist, and they will go through your practice for years. You'll never know. You'll never know. When you wake up in the morning, do you feel fabulous?
Never.
Never. And I wonder if she would just be that casual about it, getting her teeth cleaned at the dental office. She'd probably hesitate. It's like, what are you asking me that for? At least there was the hesitation, the questioning upon why were you asking me that. The person that feels fabulous, they go, well, yeah, why? Well, you taking a quiz or something? Was it a survey? You know? So, what number do you usually wake up with?
Probably a 3.
You ever wake up with a 5?
Yeah.
You wake up with a 7?
Yes.
You ever wake up and want to go and just say, forget today?
Yes.
How often would it freak you out if that happened and you woke up with an 8?
No, it don't happen very often, but when it does, it's like I can't do anything.
Okay.
It's just stay in bed.
Would it be unusual if you woke up with a 5? Would
No,
you be surprised?
not really. No.
Okay. And that was she was just aiming low at her, probably a 3. You know, how about 5? Yeah. 6 could be, you know, whatever. You know, would you be freaked out if you woke up with a 0?
Yes.
No, that'd be weird. Now we're talking weird. So a number is a version of normal. You know, her normal is a 3. Waking up with 3, okay. What do you do when you have a 3?
Deal with it.
Does a 3 ever go to a 5?
Yes.
What's the worst headache pain you get?
So severe I can't see straight.
How often does that happen?
That don't happen very often, maybe once every couple months.
Too much for me. How bad do you get a really bad one? How often do you get a really bad one?
Probably once a month at least.
What number do you have right now?
Probably a 5.
Okay. What did you wake up with?
Probably a 3.
What made it go to a 5?
Stress.
Okay. Because they're always asked that kind of stuff. Well, what did you do? Were you idiot? Don't you know you could get a 5 if you get up and walk around? It'll happen. How bad does that hurt?
It hurts.
Okay, you have to remember how bad that is then. Okay? We're going to call that a version of normal. We're going to compare it to that.
Okay.
That the same?
That hurts worse.
Okay.
That hurts worse.
About that? Oops.
That's bad, but not as bad.
So the whole point of even doing the exam and mark it down is to keep dentistry in the objective world of exam and recording and making a diagnosis of intense muscular activity. No fair saying, asking the questions and delivering a device. Don't do that. No fair doing joint surgery without an MRI in advance. Don't do that. Duh. You know, don't be drilling for decay without an x-ray. Don't be making a device for hypermuscular activity without examining and getting an objective recording of it. So what's it like when you go to the dentist?
Scary.
What's scary about it?
I'm afraid of pain.
Okay. What hurts usually?
Well, I don't like getting the shots, for one thing.
Yeah, I don't like them either. What happens after a shot?
Well, usually, I don't know if it's because I'm so stressed out or what. I haven't been to a dentist in a long time. But the last time I went, I had a root canal done, and he gave me like 4 or 5 shots to numb it, and it didn't numb it. And he said, well, you can either go ahead and get it done, or you can live with the pain the rest of your life. So I went ahead and got it done, and I felt the pain. And
just like my wife, you know. And if he had gotten you really numb, you would have married him.
I don't know about that.
Worked for me.